Hello, my name is Kip Clark from Ultimate Advanced Bodywork. I'm an advanced massage and bodywork therapist, a manipulative therapist, and I specialise in treating chronic pain conditions. And today we're just going to run through some of the techniques I use in clinic and just give you some insight as to what advanced massage and bodywork involves. So, we'll just do a bit of grounding on the person to start with, and what we're going to do now, we're just going to come in and we're just going to do some shiatsu palm pressing. So just gently compressing muscles and the ribs and the side of the spine. It's a good therapeutic technique, but you're also able to feel which areas of the spine and ribs might need mobilisations and soften it all up as we go. So while we're doing the palm pressing, we're feeling for stiff spinal segments which we might mobilise. So it's a bit stiff in there, so we're just going to slightly mobilise it just to get it moving. Just get that rib moving a bit there. From an Eastern perspective, this would be freeing up the energy in the bladder meridian as well, but it's also useful from a musculoskeletal Western perspective as well. We'll just do a bit of harmonics. So what we're doing here, we're just rocking the body in the body's natural rhythm while freeing up bits of the spine, a bit less mobile. Feels great, and it also confuses the nervous system a bit to let go of tight muscles. So you're freeing up the spine and ribs, any stiffness, and at the same time helping to get the body to let go of muscle spasm. And again, it's a bit stiff there. Might just do a little manipulation. Okay, right. So what we're going to do now, we're going to do a technique called myofascial release. So this is a very slow, gentle technique without oil to release tightness and adhesions in the connective tissue, the fascia, which covers all your muscles, but it also covers all your bones, all your nerves, all your joints, your organs, and it can get tightened and restricted, and this causes a lot of chronic pain, stiffness and other health complaints. And with myofascial work, it takes a while for the fascia to actually start to lengthen and release and move. So you have to wait and be patient and feel until you get that release, and then you follow the easing and the moving of the tissue as it releases and lengthens. This is an indirect form of myofascial release, which is better for chronic pain conditions, because lots of chronic pain is due to fascial adhesions, and normal massage and mobilisations don't do much to release them. You need myofascial release to do this. Direct myofascial release is, we'll show you in a second, is more for postural problems and also if there's misalignments in the body like scoliosis or say torsion pelvis, then you might employ more direct myofascial as well as mobilizations or manipulation. Indirect is better for freeing up the things that cause pain. And again, we're just applying a bit of a harmonic rocking and rebounding just to help release the tissue. Okay, so what we might do now, we're just going to do some osteopathic cross fibre, well, it's cross fibre kneading technique. So this is really good massage technique to help free up the big muscles going down the back. So just sink the palm of my hand in. It's really slow, and then once you've got a good connection with the muscles, then we focus it and just spread the muscles out, trying to spread all the fibres out. And with good deep tissue techniques and good cross fibre work like this, the strokes should be really slow. They feel much better and have much more effect than fast work. So gathering the tissue, focusing it on the harder part of my palm, and then spreading it out away from the spine. And again, gather the tissue, focus, and spread. Okay, so we'll do some direct myofascial work now. This is the type that we'd use for postural problems. So people often have, they're too hunched in their mid-back, they've got too much dip in their lower back. So to use direct myofascial release, you might pull the fascia in to the centre of the spine to correct a mound. So if someone's got too much curve in their upper back. So we're doing little chevrons in, pull the tissue in to reduce the mound, and in the lower back where there's often too much dip, we would spread the fascial tissue out from the spine. So you're trying to lengthen the areas where the fascia has got too short and tight, or move the fascia into a better position in the body to correct the structure of the body. You'd also give the person stretches and strengthening exercises to complement this. Okay, so we're just going to do a bit of deep tissue massage now. So just apply some oil. And we're going to use our forearms because they're really good for doing deep tissue. Gather the muscles up And slowly work through them with a relaxed forearm, making sure you use the soft part of your arm. Good deep tissue, shouldn't be painful, should be slow and firm but comfortable. Okay, so what we'll do now, we're going to do some trigger point therapy, and trigger points are little points within the muscle, tendon, ligament or fascia, and they cause local or referred pain, but they're supposed to be cause about 80% of chronic pain. So most chronic, i.e. long-term pain, is actually due to muscular problems and trigger points rather than problems with pinched nerves and stuck joints. So and a lot of these soft tissue problems don't show up on conventional medical tests. So we're just going to scan through with our elbow, and when we feel a trigger point, just hold pressure on it until the pain eases. They may refer into a different area. These erector spinae muscles refer into the lower back quite often. Just dropping into a different one, and then doing some deep tissue through afterwards. Holding another trigger point with my knuckles. And then massaging through. And again. The trigger point, the pressure used for trigger points should never be very painful. It should be a kind of moderate, good discomfort. If it's excruciating, then you're doing it too hard, and the person won't be able to relax into it. And you can also use your fingers and your thumbs to focus in on the trigger points, and just wait for the trigger point to ease and relax. I can feel this now. When you first start doing trigger point therapy, you need verbal feedback from the patient, but you soon get used to feeling the points and feeling when they relax. We're doing some cross fibre work as we release the point. Okay, just massage that down. Okay, I hope that gives you a better understanding of what I do, and you can get more information on www.alternateadvancedbodywork.com, or pick up a leaflet in the reception of Complete Feet. Thanks very much.